Vanakkam and welcome to Metier Academy, one of the leading academy in training nurses in the nursing competitive exam as well as IELTS and CLEX and OET training. And welcome back to Magic Pill session. Today we are going to discuss in detail about occupational hazards. So for whatever the question asked in previous year question paper, that question we are going to discuss. In specific 5 questions we are going to discuss, and additional point, that is vital point, which is related to that particular question also we are going to discuss. So watch the video till the end. Definitely it will be so much useful for you. And if you like the video, please like it, share it, subscribe the channel guys, so that it will motivate us to post more and more videos. Most of the students are watching the videos without subscribing the channel. Please subscribe the channel. It will make us to post more and more videos. It will act as a motivational source for us. Okay, so let's begin the session. With your motivational thought, we are going to start with the session. When you want to give up, remember why you have started. See, most of the student, after getting 2, 3 failures, immediately they will give up. Okay, so you should not give up like that. You should always remember why you started this preparation. You started this preparation to come into the service, government service, right? So you have to remember why you have started. This much time we have spent for this preparation. We should not leave this. Okay, so this kind of thought has to be keep in mind, and with this thought you have to move forward. Okay, so with this motivational thoughts, let's start the session. As I mentioned already, today we are going to discuss very important topic, that is occupational health from community health nursing, and MCQ and vital points we are going to discuss. The first question what we are going to discuss is, always you know that we will be discussing from simple to complex. So this part what we are going to discuss today, all the questions are already asked in the exams, and also a simple but repeatedly asked questions. Please make a note of it. Okay, simple questions only, but repeatedly asked questions. Okay, fine. So the first question what we are going to discuss is, white finger may result from which of the following occupational hazard? The key points are white finger, occupational hazards. Okay, so this question asked in DSSSB exams. 4 options they have given here: heat, cold, UV ray radiation, and vibration. Among these 4 options, which one will cause the white finger? Okay, so here the right answer is option D, that is vibration. How the vibration will cause the white finger? Is there any other name for the white finger? Yes, let's see in detail about the rationals also. You can see it is very clearly given here. Let me show the image also. In this image, you can see the white fingers, right? And this is the normal color of the finger, and this is the white finger. So this white finger, it is also called as Raynaud's syndrome. What syndrome? Raynaud's syndrome. Raynaud's syndrome is a familiar word, familiar name. So many times you would have been studied about Raynaud's syndrome. In Raynaud's syndrome, as you all know, that the small arterial capillaries is going to get contract. Once the arteries, small capillaries, arterioles are going to get contract, immediately the blood flow is reduced to the particular finger. Okay, in that situation, the finger is going to become pale or white. Okay, so this situation we used to call it as what? Raynaud's syndrome. So in what condition this type of Raynaud's syndrome is also called as white finger. Please keep in mind. So in what situation this type of Raynaud's situation or contraction of the arteries will take place? See, the first and foremost reason for this Raynaud's syndrome is cold temperature. Apart from that, emotional stress, this kind of vibration is the answer for the question what we discussed today. So these are all the other etiological factors. See, vibration in the sense, it is not like normal mobile vibration. The vibration which is having up to 500 hertz. 500 hertz means if you are using a tuning fork, it will give up to 512 hertz. When you are doing Weber's test and Rene's test, you are using a tuning fork. If you tap and if you keep over the labella or in the mastoid bone, you can feel the vibration, right? So that is 512 hertz vibration. Okay, so same like that, any vibration which is happening in the hand or in the fingers up to 500 hertz, that may cause this type of Raynaud's syndrome or white finger. Okay guys, Fine. So this is the answer for the first question, that is vibration, and I have given the rationale also. Let's see the second question, which is the most common occupational hazards of computer worker, the person who is working continuously in computer like desktop or laptop. So which is the most common occupational hazards for those people? This question is asked in two exams, that is AIIMS and RPSC. Four options they have given here, like cancer, lung disease, cataract, and carpal tunnel syndrome. Okay, so for each question we used to find out the key point. Here the key point is for computer worker, which is the commonest disease, occupational hazards. Okay, and here the right answer is option D, that is carpal tunnel syndrome, CTS. Carpal tunnel syndrome is commonly seen among the computer workers. Okay, so let's see the rationale. See, carpal tunnel syndrome, as you all know, it is a very familiar term. It is caused because of continuous stress in the wrist. Okay, so for example, a tennis player or a cricket player or a person who is working in the carpentry or rowing means boat rowing, okay, typing or using the computer for a long period of time, for on all these things, it will cause straining over the wrist. And in the wrist, let me show the image. You can see the median nerve. It is running in a longitudinal direction towards all these fingers. Okay, so if the wrist is affected, means automatically the median nerve, which is running in the center of the wrist, it is also going to get damaged. Okay, so at last numbness and pricking sensation will be felt among the fingers. Okay, so it shows that the patient is suffering from medial nerve injury. It is also called as carpal tunnel syndrome. See, carpal tunnel syndrome is nothing but medial nerve injury or compression. Okay, fine. So for this question, which is the right answer? Option D. For computer worker, the common problem is carpal tunnel syndrome, medial nerve damage. Okay, fine. The next question what we are going to discuss is this question asked in BSF, that is Border Security Force Toughness exams. Occupational disease caused by the coal dust. Okay, so as I mentioned already, all these questions are asked so many times in the exam. So even though it is a simple direct question, but still it is very, very important to review each and every questions. Okay, so occupational disease caused by gold dust is anthracosis, silicosis, asbestosis, and bagosis. Four options they have given. Coal dust is the key point here. Even though it is a direct question, coal dust is the key point here. And here the right answer is option A, anthracosis. Anthracosis means it is caused by the coal dust. Let's see the rationale in detail. See, anthracosis, it is also called as coal worker pneumonia, guys. Okay, other names are very, very important. Always please remember that. Okay, always they will not ask directly anthracosis. They will ask in some other name also. So anthracosis, it is also called as coal worker pneumonia. It is also called as miner's black lung. Okay, in the coal mines, the person whoever working in the coal mines, they will be having a black lung. It is because of the accumulation of the coals over the lobes of the lungs. Okay, it is because of inhalation of the coal dust. Okay, guys. So anthracosis, as I mentioned already, in the coal, carbon based particles will be present. Those particles is going to accumulate all over the lung and it will create a black color lung. Okay, fine. So this is called as what? Anthracosis. The next option is asbestosis. See, asbestosis is a chronic lung disease caused by inhaling asbestos fibers. Have you seen asbestos? So in that fibers will be there. Okay. So by inhaling the asbestos fibers, the patient will be having this kind of asbestosis. Okay, fine. So what are all the manifestation the person will be getting if he is getting asbestosis? See, the lung tissue scarring and shortness of breath is the manifestation which is commonly seen among the asbestosis patient. Okay, the next option what they have given here is silicosis. So silicosis is commonly seen among the person who is working in rock, clay, sand. Okay, so these kind of materials, if they are working means, so from these materials, from rock, clay, sand, the finest silicon dust will go inside the lungs and it will cause what? Silicosis. Okay, so silicosis is very common occupational lung disease in the world. If the exam, if they are asking which is the very common occupational hazard disease or very common occupational lung disease, that time you have to select what? Silicosis. Is that clear? So anthracosis, coal dust. Asbestosis, asbestos fibers. Silicosis, it is a silicon dust which is generated from the sand, rock and clay. Okay, and this is silicosis is a very commonest occupational lung disease. So these are all the key points always you have to remember. The next one is inhalation of the cotton fibers, guys. So this question also asked many times in the exam, 3 times. Recently, they have asked in the exams. That is Safdarjung Hospital, ESIC and HPSSC exam. They have asked this question. Inhalation of the cotton fiber dust over a long period of time. It will cause what? Silicosis, anthracosis, bichinosis and bagosis. 4 options they have given here. Among these, already we have discussed many meaning of each and every options. Okay, repeatedly the options are coming here also. Let's see. The right answer here is option C, bichinosis. Cotton fiber means you have to keep what in your mind? Bichinosis. Okay, if the person is inhaling the cotton fiber dust, the person will be getting what? Bichinosis. Option C is the right answer. Let's see the additional golden point. Bichinosis. It is due to inhalation of the cotton dust. Okay, mostly who will get this disease? The person working in the textile industries, those people will be prone for getting this disease. The risk factor prone for vulnerable to get the disease is also very important for your exams, guys. Okay, so if the person got this bichinosis because of inhalation of the cotton fibers, so what are all the symptoms will be there? See, tightness of the chest, altered respiratory pattern means dyspnea will be there for the patient. Usually, you know, Monday to Friday, they will be working in the industry. Okay. So Saturday, Sunday will be off. Otherwise, Sunday will be off. Sunday, they will not have any kind of manifestations. Okay. But once they enter inside their job on Monday, immediately the symptoms will start. The beginning of the symptoms will be there on the first day of the working day. Okay, so that's why it is called as what? Monday fever. So bichinosis is also called as what? Monday fever. It is also called as mill fever, also called as brown lung disease. All the key points I have highlighted here, very important for the exam. So Monday fever is also called as bichinosis, also called as mill fever, also called as brown lung disease. Okay, fine. The last question what we are going to discuss today is inhalation of the sugar dust. Sugar cane dust. First, you should know what is sugar cane dust. Sugar cane dust means after eating the sugar cane, we used to split the waste material, right? So that is called as what? Sugar cane dust. Okay, so that particular dust is called as bagasse. Okay, here you can see in this image the sugar cane. After we chewing the sugar cane and we are splitting it, immediately it is becoming a abnormal shaped sugar cane, okay, without any juice, right? So that part is called as what? Bagasse. Okay, so this bagasse is related to this question. So let's see. So inhalation of the sugar cane dust, this bagasse is the sugar cane dust. Okay, so this dry bagasse is the sugar cane dust. Please keep that in mind. Okay, so inhaling this dry bagasse will cause what? The right answer is option D, bagosis. Okay, from the name itself, from bagasse, this name is arrived, that is bagosis. Okay, so what is this bagosis? See guys, bagosis is a rare airborne occupational lung disease caused by inhaling this dried bagasse. Inhaling this dried bagasse. I have highlighted the important point in the yellow color. Please make a note of it. Okay, and also bagosis is happened because of inhaling this dried bagasse. Apart from that, it is a bacterial disease. Why? This dried baggage, it is consisting of thermophilic actinomyces. Thermophilic actinomyces vulgaris, it is a bacteria which is present in the dried baggage. If the person is inhaling the dried baggage, he is also inhaling the bacteria, that is thermoacetomites vulgaris. Okay, so that time there is a chance for getting this bagosis. Okay guys, so in this questions. We have discussed so many important points like silicosis, anthracosis, bicynosis, bagosis. Okay, so all these important points are very, very vital for your exam. So many times these questions are asked in the exam. So if you have any doubt anywhere related to these questions and any vital points, you can drop your message in the comment section. I will be clarifying your doubt. And thank you very much for watching the video. As usual, please subscribe the channel so that it will motivate us to post more and more videos, guys. So thank you very much.